So, in this video, we will explore what haematochezia is, its potential causes, when to seek medical attention, and the importance of understanding and addressing their symptoms. And lastly, we will talk about the homeopathic treatment along with the best homeopathic medicines that has been successfully used for the treatment of haematochezia. So if you are suffering from haematochezia, then this video is definitely for you. So watch this video till end for more knowledge and stay connected with us for more informative videos like this. So let's start. So first of all, I would like to explain what exactly is the meaning of haematochezia, or presence of bright red blood in your stool. Haematochezia can be a symptom of various underlying medical conditions, ranging from minor issues like hemorrhoids to major serious problems like GIT bleedings or colorectal cancer. So, this is the exact meaning of haematochezia. I hope this is clear to you guys. Now, next, we'll talk about the potential causes of haematochezia. So, let's talk about the etiology which is responsible for haematochezia. So, first and the foremost potential cause for haematochezia is hemorrhoids, or you can say piles. So, hemorrhoids are a common and benign causes of haematochezia. They are swollen blood vessels in the rectum or the anus. Second causes is anal fissures. So, anal fissures are the small tears or cuts in the lining of the anus, which can lead to bleeding during bowel movements. Third cause is diverticulosis. Diverticulosis means the presence of small pouches in the colon, which can cause bleeding if they become inflamed or rupture. Next cause is gastrointestinal bleeding. So, more severe cases of haematochezia can be linked to the GIT bleeding, which can result from conditions like gastritis, ulcers, or colorectal cancer. Now, fifth cause of haematochezia is IBD, means inflammatory bowel disease, that is Crohn's and ulcerative colitis. So, these two conditions can cause bleeding in the digestive tract. Now, last cause is infection. So, infection is another possible cause of blood in the stool. Infection that causes bloody diarrhea is also known as dysentery, and other causes can be so other causes of the blood in the stool include colitis, means inflamed colon, constipation, diverticulitis means inflamed digestive tract, gastritis means inflamed stomach lining, and proctitis, which means inflamed rectum. So these are some potential causes which are responsible for haematochezia. Now we'll talk about the symptoms. So let's talk about the clinical features of haematochezia. So now we'll talk about some symptoms and the characteristics which are associated with blood in the stool. So first symptom that you can see is visible blood. The most obvious symptom is the presence of dark or black colored blood in the stool. This blood may be seen as streaks, clot, or mixed throughout the stool. Second symptom is change in stool color. So, stool with blood may appear black or terry, that is melena, or bright red, depending on the location and the source of the bleeding. Next symptom is rectal bleeding. So, blood may be noticed when weeping after a bowel movement, or it may drip into the toilet bowl. Next symptom is abdominal pain. So, some individuals with blood in the stool may experience abdominal discomfort or cramping, and depending on the cause of the bleeding. Next symptom is change in bowel habit. So, hematochezia can sometimes coincide with the changes in the bowel movement, such as diarrhea or constipation. And last symptom that you can observe is fatigue. So, chronic blood loss from the GIT, gastrointestinal tract, can lead to anemia, which may result in fatigue, weakness, and pale skin. So, these are the symptoms of hematochezia. Now, next we'll talk about when to seek medical attention. So, if you or someone you know experience hematochezia, so it is very crucial to take it a serious condition and seriously and seek medical attention under the following circumstances. So listen this very carefully. When you have to take medical attention, okay, so don't avoid it and seek medical attention immediately. So the first symptom is bleeding is severe or persistent. Second, there is a family history of colorectal cancer. Third, the person is over 50 years of age and hasn't had a recent colonoscopy. Next, there are additional symptoms like abdominal pain, weight loss, and changes in the bowel habits. And last is there is a history of IBD, that is inflammatory bowel disease. So if you suffer from such conditions, then you need to seek medical attention immediately. Don't avoid it. Now, next, we'll talk about the investigation. So, what are the various tests that one can perform in order to diagnose hematochezia? So, let's talk about the diagnostic criteria. So, if you have hematochezia, your doctor will likely start with the colonoscopy. This involves inserting a small tube with a camera throughout your rectum. The device will give them a view of your lower GIT, including your colon, so they can pinpoint where the blood is coming from. And during this procedure they may also take a small tissue sample for additional testing. Another test that can be used to diagnose the cause of hematochezia include first test is enteroscopy. So in enteroscopy, what happens, you will swallow a small capsule containing a camera that produces images of your GIT. Next test is barium X-ray. So your doctor will have you swallow a contrast material called barium. They might also insert it into your rectum, and this will help your GIT shows up on the X-ray. Next test is flexible sigmoidoscopy. A flexible sigmoidoscopy is similar to colonoscopy but only examines your lower colon. Last test is EGD, that is esophagogastroduodenoscopy. So during EGD test, a doctor puts a long tube with a camera down your throat to examine your esophagus, your stomach, and your upper part of the small intestine. And the last test is laparotomy. So laparotomy is a more invasive test that involves surgically opening your abdomen to find the source of bleeding. So these are the various tests that one can perform in order to diagnose hematochezia. Okay, this was all about the investigations. Now let's talk about the treatment. So, what is the ultimate treatment for hematochezia? That is, when blood appears in your stool. So, yes, we are talking about the homeopathic treatment. Now we will talk about the homeopathic medicines which has been successfully used for the treatment of blood in stool. Let's talk about the homeopathic treatment. So, homeopathic medicines are the natural medicines that act as very powerful anti hemorrhagic agents to control bleeding from gastrointestinal tract appearing in the stool. The homeopathic medicines are of great help in tackling blood in the stool. The first and the foremost aim of the medicine is to halt active bleeding in the stool, and the second aim is the treatment of the underlying cause leading to blood in stool. The homeopathy mode of treatment has zero side effect and it is completely safe. Now, first and the foremost medicine that you can see here on the screen for blood in stool is, so we have two medicines, that is phosphorus and nitric acid. These two medicines are mainly used for bright red blood in stool. So let's talk about them one by one. So first of all, we talk about phosphorus, then we'll talk about nitric acid. So phosphorus. So phosphorus act as a best anti-hemorrhagic homeopathic remedy when the stool contains red blood cells. When the stool contains red blood with loose stool, phosphorus is a very effective remedy when the bleeding is very profuse, bright red, and the stool is also very offensive. Extreme exhaustion following by bleeding. The person needing phosphorus may have a desire for cold drinks, ice cream, juicy things, along with blood in the stool. Now, second medicine we have is nitric acid. So, nitric acid is the ideal homeopathic remedy when the blood in the stool is bright red and constipation is dominant. Along with the blood in the stool, the patient also experiences violent pains in the rectum. And nitric acid is the best homeopathic remedy for the blood in stool due to anal fissures. So, for using nitric acid, also, the bleeding in the stool is profuse. The next homeopathic medicine for blood in stool is hemomalice. Hemomalice is a wonderful homeopathic medicine for treating dark blood in stool. Along with bleeding, there is a sensation of burning in the anus. The important feature with blood in stool is utmost weakness. The bleeding is very profuse and the cause can be piles, ulcers of intestinal fissures or dysentery. A few patients needing hemoptysis may also have a severe backache along with the bleeding in stool. The next medicine for blood in stool is Nux vomica. Nux vomica is a very wonderful homeopathic medicine for blood in stool with the frequent urge to pass stool. Now let's talk about it. The stool passes in small in quantity and the desire to pass stool is almost constant with the blood in the stool. Another feature that can be present is cramping in the abdomen along with frequent stools with blood. The cramps get temporarily better after passing stool but are soon renewed. Nux vomica is a very excellent homeopathic. Nux vomica is also a wonderful homeopathic remedy of great help when taking spicy food or stimulants like alcohol and coffee worsen the condition of blood in stool. Now, next homeopathic medicine. So we have two homeopathic medicine that is Nux vomica and Collinsonia. So these two homeopathic medicines are mainly used for blood in stool due to piles or you can say hemorrhoids. So let's talk about it. First, we'll talk about Nux vomica, then we'll talk about Collinsonia. So Nux vomica is recommended when stool is constipated and blood in the pile is seen. The constipation is characterized by frequent desire to pass the stool with only little passage. The desire is almost the desire is almost constant and stool is unsatisfactory. Second medicine we have is Collinsonia. So Collinsonia is the ideal remedy, homeopathic medicine, when severe pain in the rectum accompanies with bloody stool in pile conditions. So for using Collinsonia, there is a specific feeling of sharp sticks filling the rectum. Here also, the stool is constipated, but there is no frequent discharge. There is no frequent desire to pass stool. The stool is mainly very dry for using collinsonia, and itching in the anus may also be felt. Now, next homeopathic medicine for blood in stool, we have two medicine that is nitric acid and anal fissures. Now, one by one, we'll talk about them. First, we'll talk about the nitric acid. So, nitric acid is of great help for treatment of blood in stool due to anal fissures. I have already talked about this. Next medicine we have is next medicine we have is Illumin. So Illumin is a homeopathic prescribed medicine when constipation of the worst kind accompanies bleeding in stool due to fissures. Here pain and itching in anus also appear with bleeding. The next homeopathic medicine for Haematochezia is Mercor and Merxol. These two homeopathic medicines are successfully used for blood in stool due to dysentery. Now, what is dysentery? I think you all are very much familiar with this term, but again, I would like to explain it. So, dysentery is a condition where a person passes loose stool containing blood and mucus. Along with these, there is a pain in the abdomen and tenesmus. Tenesmus is a condition where there is a persistent desire to pass stool. So Mercor and Merxaw are two good homeopathic medicines for blood in stool due to dysentery. Now we will talk about these medicines. So first we have Mercor. So Mercor is used when the stool is offensive, it is hot, there is a desire to pass stool is persistent. And if we talk about the Merxaw, so on the other hand, is the most appropriate homeopathic medicine when blood in the stool and tenesmus get worse at night. The patient can even faint and a few may also have a chilly sensation after passing stool. Okay. Now, next homeopathic medicine for Haematochezia is we have three medicines that is Merck, Sol, Hemomelis, and Nux vomica. So these three homeopathic medicines are considered best homeopathic medicines for bloody stool due to ulcerative colitis. So we are talking about IBD, inflammatory bowel disease. Now one by one we'll talk about them. So first we have is Merck Sol. So Merxol is the ideal homeopathic medicine for blood in stool with chilliness. Here bleeding is worse at night. Abdominal colic with unsatisfactoriness accompanies. And last we have Nux vomica. So Nux vomica work best when tenesmus with blood in stool is the main complaint. The person needing nux vomica has a frequent urge to pass stool, which is insufficient and unsatisfactory. Okay. Now, next medicine we have is millefolium. So, this is a very good homeopathic medicine for the rectal bleeding from piles. Let's talk about it. Injuries. Now, last but not the least, we have natrum muriaticum. So, natrum muriaticum is an excellent homeopathic medicine for treating rectal bleeding from constipation and hard stool. The stool is hard, dry, irregular, and unsatisfactory, expelled with difficulty and with bleeding per rectum, where natrum mur is indicated. Stool passes in large masses or is crumbling or pass like sheep dung. The anus is constricted, stitching, pain in the anus are felt. There is a burning and smarting pain in the anus, appear frequently after stool. So, this was all about the last homeopathic medicine, Natrum muraticum. So, these are the homeopathic medicines which has been successfully used for the treatment of haematochezia, that is when blood appears in your stool. So, that's all for today. So, in conclusion, I want to say that haematochezia, or you can say presence of blood in your stool, can be a symptom of various conditions, and some of which are minor while other may be very serious condition. So it is very crucial not to ignore this symptom and to seek prompt medical attention when it occurs. And remember, early detection and appropriate treatment can make a significant difference in your overall health and well-being. And as we all know that today is Vijayadashmi or Dashera. So I want to wish you all a very happy Dashera or Vijayadashmi. And I would like to share my few words on Dashera with you all. So Dashera conveys a profound and timeless message. And what is that message? The ultimate victory of the virtue, truth, and the righteousness over wickedness and deceit. It serves as a reminder that no matter how powerful evil forces may seem, they will ultimately be vanished by the forces of goodness. It encourages us to stand for truth, uphold moral values, and celebrate the victory of the good over the evil, and not just today, but in our daily lives. So, if you find this video informative and helpful, please give it a thumbs up and subscribe to our channel and hit the notification bell so you won't miss any future content. Thank you for joining us today, and we'll see you in the next video. Till then, stay safe and stay healthy. And if you are suffering from hematochezia or any other health illnesses, so you can contact us for online appointments. On the screen, you can see how you can contact us for online consultations. Okay, so that's it for now, and thanks for watching this video. And again, I would like to wish you all a very happy Dashera.